Now, the topic is all about the salutogenesis and yoga therapy. The platform is yours, sir.
Thank you very much. I hope that my screen is visible and that you can see the PPT that is there. Today I'm talking about understanding salutogenesis and yoga therapy. And I would like to take the opportunity to thank Professor Ilangovan, his team at MAHER for organizing this event. I begin by invoking the Guru Parampara. I hope that we can see the screen with the Guru Parampara on it. Please do let me know if my slides are not moving. Tad Paramparaye Vidmahe Jnanalingeshwaraya Dhimahi Tanno Guru Prachodayate Om Yoga Maharshi Dr. Swami Geetananda Giri Guru Maharaj Ki Jai. Om Puduvai Kalemamani Puduvai Shakti Yogacharya Amma Ji Meenakshi Devi Bhavanani Guru Mata Ki Jai. Om Shri Guru Pyo Namaha Hari Om. So I'm representing Saiter of Sri Balaji Vidyapeeth today, and at our university, our focus is salutogenesis, and that is the focus of my topic also today. That we want to move from pathogenesis, a focus on disease, towards salutogenesis, a focus on health. And I offer this presentation to my loving mentor, our former Vice Chancellor, Professor Seduraman sir, who introduced us to the concept of salutogenesis and its importance in healthcare. I hope that you can see a very beautiful image of him with me there. We have moved from CAM to TCI medicine, complementary and alternative medicine. We have moved from the alternative, you or me, to complementary, which is you and me, to integrative, which is us, where we become a team. And in this TCI medicine, where does yoga fit in? Yoga therapy, we must remember, it is nesting inside the larger yoga, and hence is neither separate nor greater than yoga. And today we have numerous standard textbooks on yoga therapy. We have associations for yoga therapy. We have journals of yoga therapy. And if you go to PubMed, you can see nearly 7,000 results for the term yoga therapy in PubMed. But the credit to this whole integration of yoga in the modern medical setting must be given to Professor Madan Mohan sir, who has been a pioneer in integrating yoga and modern medicine during his more than 3 decades at JIPMA, and following that at SBB, and now at the Vinayaka missions. Health is a dynamic state, and it can be understood as a dynamic movement, a continuum between dis-ease, which is pathogenic, and ease, which is salutogenic. So we are moving towards health. The term salutogenesis comes from the Latin salus, which means health, and Greek genesis, which means the source. So in combination, sources of health. And for salutogenesis, the heart of salutogenesis lies in what is called the sense of coherence. The sense of coherence means that there is a long-lasting dynamic feeling of confidence that our internal and external environments are predictable, and that things will work out as well as can be expected. And when we have a sense of coherence, there's strong positive correlation to perceived health, mental health, and quality of health. The first of the components of this SOC is that it should be comprehensible. My world is understandable. The second is a coping skill. My world is manageable. And the third part is motivation. My world has meaning. So when we can look at our life and we can say, my world is understandable, my world is manageable, my world has meaning, well, we are having a sense of coherence and salutogenic wellness. Now, what happens when you don't have it? You go into pathogenesis. So pathogenesis is looking at what is the disease. We are trying to avoid the problem. We see disease and we want to be reactive so that we don't have disease. We don't want pain or loss, and we try to keep ourselves alive. But salutogenesis is looking at health. How can you reach your potential? It is proactive. We want the presence of health, not just the absence of disease. We want to grow and discover how to live life fully. Hence, when we look at the illness-wellness continuum, the treatment paradigm, which is pathogenesis, looks only at one component, but the wellness paradigm, salutogenesis, goes right from the bottom to the top, right across the continuum, enabling wellness to manifest. When we talk about being a yoga therapist, we must have intelligence and empathy. We must be willing to share. We need to understand our limitations, realize we are not perfect, be willing to embark on a continuously expanding learning curve, because the day we stop learning is the day we stop living. And if we let our ego come in, everything stops. When we look at the definition of health from the WHO, it talks about a dynamic state of complete physical, mental, social, and spiritual well-being. And this is the very same wellness given to us by the Ashtanga of Maharishi Patanjali. Yama Niyama contributing to social health, Asana Pranayama to physical health, Pratyahara Dharana to mental health, and Dhyana Samadhi to spiritual health. And this wholesome wellness of salutogenesis is understood in our culture as Swasth. Acharya Shushruta, 600 BC, tells us that there has to be this balance, wellness, and there should be a tranquil contentment to be well. When you look at the modern yoga therapy, we understand the definition. It is a professional application of the principles and practices of yoga to promote health and well-being. This is the focus of salutogenesis. Within a therapeutic relationship, there is personalized assessment, goal setting, lifestyle management, and yoga practices for individuals or small groups. Again, coming back here, Antonovsky, who first has given us this term of salutogenesis, explains that when a stressor comes in, and we all have stress in life, the stressor that comes in creates a tension. How we perceive that tension can lead us along salutogenesis towards health and wellness, or pathogenesis towards breakdown, disease, and death. So the leap is upstream, moving from pathogenesis towards salutogenesis. And this is where yoga therapy enables salutogenic wellness to manifest. It works at the level of the body, mind, and spirit. At the body level, restoring function, creating healing. At the mind level, reducing suffering and creating healing. And at the level of the spirit, reducing suffering and creating community. And hence, all aspects of the pieces are brought together in that wholesome Purna Swarupa of health itself. This is well understood through the psychoneuroimmunology, where the nervous system, immune system, endocrine system, they all work together. And we realize that the perception of stress is what creates the stress. If you don't perceive something as stressful, it's not going to matter to you. So the perception of stress is what we want to change through yoga, changing the perception of stress. Because if you look at the impact of stress on the hypothalamo-pituitary adrenal axis and sympathetic nervous system, the whole cascade down from stress to disease, adi to vyadi, we find that yoga can impact positively at all the levels. And the most important level is relaxation, because relaxation is the key to healing. When we are healing, when we want healing, we need to relax, and it facilitates the relaxation response. And this is why I'm convinced that yoga's greatest contribution to modern healthcare and wellness is by yogic relaxation, because it impacts in a positive way that same psychoneuroimmunology, which was impacted negatively by stress. And this is where to have salutogenesis, the yoga therapy is not just about asana and pranayama. It's not even about a few meditative techniques, but it is about a whole healthy lifestyle where our activities and exercise, achar, our thoughts and attitudes, vichar, our diet, ahar, our recreation, bihar, and our relationships, vyavahar, are all brought into a sense of wellness. Because healing is ultimately multifactorial. Lifestyle on one side, attitude on the other side, relaxation and breathing, and they all contribute to healing. And healing is what salutogenesis wellness is about. You don't just want to cure, you want to heal. And this is where the lifestyle, the attitude, the breathing, the relaxation, all of them are found in yoga. And you don't have to take an injection for it. You don't have to take a pharmaceutical agent that will have side effects. Instead, through yoga, you get the side benefits of the practice. And this is why today we realize we are moving into a biopsychosocial spiritual model of wellness, biologically affecting all the biological systems, socially affecting all our sociological aspects, the psychological aspects through the mind, and the spiritual aspects where we feel connected to the whole universe. A very beautiful schematic given by the Yoga for Better Health team, where the biological, social, psychological, and spiritual aspects of our humanness are all brought into that beautiful state of wellness through the practice of yoga therapy. And the core principle is we need to shift from the focus on me, to the focus on we. Moving from an individualistic tendency to only focus on what's in it for me and limit yourself, moving into a collectivistic, universal perspective where we understand we all are having a shared human experience, and that experience is enhanced by the practice of yoga. And the key element here, resilience, because the resilience is what helps you bounce back. During the COVID pandemic, we have all gone down, but it's nothing wrong about falling down. No shame in falling down. But the shame is if you don't get back up again. So 99 times down, 100 times up is resilience. And for this, you have to enhance your capacity, empower yourself through yoga, and be ready to face the challenge. When your capacity is high and the challenge is high, you start to grow. That is the conscious evolution of yoga. And this is where we need to refocus on wholesomeness and salutogenesis and move consciously from dukkham to sukham. This type of approach where salutogenesis and yoga therapy comes into the modern medical healthcare system. It is what is 21st century medicine, as said by my beloved Dada, Dilip Sarkarji, who is the past president of American Heart Association as well as the International Association of Yoga Therapists. If you want to have a sense of wellness, if you want to have that sense of salutogenic well-being, that swasth, you need to have gratitude, because gratitude is the highest attitude. When we have gratitude to life, we will strive to be the best version of ourselves. And in doing so, we will affect the world in a positive manner. I would like to thank the whole team at MAHER, especially Professor Ilangovan sir and others, for this invitation to address you in this memorable event on the International Day of Yoga. We at Saita of Sri Balaji Vidyapeeth are happy to share our expertise with all of you and welcome you to visit us, join us. And as we share, we care. And as we care and share, we all grow. That is the message I want to share with you today. Let us all be the best version of ourselves. Hari Om Tat Sat. Nandri Vanakkam. Dhanyavadaha.